Welcome back to Tales of Truth. This is where we tell the truth about veterinary medicine. I'm Dr. Angie, and this is my nurse, JoJo. And this week, we are talking about dentistry, your pet's oral health, and the truth you need to know.
This is one of your favorite. This is like one of your sweet spots.
I love teeth so much, kind of in a weird way. I think it is. The way I love teeth and oral surgery, I think, is strange, but it's going to be beneficial for a bunch of pets.
Yeah. So. I know this. I feel like this is such an underplayed card in veterinary medicine in terms of longevity and health. It should be talked about more.
Yes. The way you talk. No. The way you care about your cat or dog's teeth is going to have a huge impact in their longevity, their overall health, inflammation. It is really underrated, and I wish that we would talk about it more.
I mean, it's the same in human medicine, right? I think when we get into the dentist's office, they're like, if you would just floss
those teeth, like most days.
Like you could save yourself. And I think we forget that, dogs and cats have teeth and oral health too.
Yes, and most people aren't brushing them every day, including myself. And so
I'm in there too.
Let me see if I can find a cat. They've been around this morning. I don't brush my cat's teeth every day, but I totally recommend that everyone else should. And if you can't, that's okay, and it's reasonable. But there are some things that you should be doing to at least check on their teeth. So I ambush my cats when they're asleep, and I open their mouths and look at them. And so I am very aware of what's happening in my cat's mouths, even though I'm not getting out the toothbrush and I'm not every day. This is the stuff, here we go, the camera. This is what I recommend. It's PerioCare by RX Vitamins. And I really like that for oral health. And I use it sometimes, but sometimes is better than none. And so I think if any listener could walk away with an actionable step, is to just look in your pet's mouth.
Yeah.
Just look and get them used to you looking, even if you can't brush.
I'm a sleep ambusher too, though.
You are?
Yeah. When they're laying, I have dogs. So when they're laying next to me on the couch, I just kind of lift that lip and run my finger across and just see how is everything looking in there.
Yes. So. It's important. And so if you're listening to this, you're not going to be able to see it. But if you're watching, I want to show you, if you have a dog, which teeth you need to be looking at. So I'm going to hold this up. So this is your dog's mouth. And so you're going to pull that lip back. And this is the tooth that I want everyone to be paying attention to. And that is the tooth that often gets a slab fracture in dogs from chewing on anything harder than their tooth enamel. And they will never tell you that they have a slab fracture there. And what happens is that bacteria get into the root and cause a really painful abscess. And sometimes we just find them on dentistries.
And we just did this with my dog.
Just took
him in. Well, his breath got really foul and I couldn't quite see that slab fracture. And they didn't find it until they were in for dentistry.
Okay.
And it was a complicated removal, right? So that got pricey.
Yes.
And I broke the rules, and he's not necessarily a responsible chewer. So I let him have a marrow bone from the grocery store.
Yeah. That'll do it. And most dogs aren't responsible chewers, but some of them are. Well, I've been graced by my cat, Fritz.
Yeah, do it, Fritz. Hi, Fritz.
I want to see if I can show anything off. I probably can't, because I probably can't get him high enough. Let's see. I can show you how I look in cat smiles. Usually he's asleep. He says, I'm not going to let you do that. Okay, I love you. Usually what I'll do is I look in their mouths in two ways. One in a really loving way and one in a very annoying way. In the very loving way, I just kind of pull back the corner of their lips and just take a peek. And then the other way is I will put my fingers on the front of their incisors and I will pry back and open and look down in the back of their throat. And I feel like for cats, both views are very important.
Why specifically cats?
And cats can get oral tumors, and they can have, it's like if your cat is playing with a string, they can get strings caught back there and under their tongue. And so I like to look at both. but I mostly ambush them and look from the side. Now with cats, my cats, of course, broke my cat model. This is not what cat teeth look like, but there is a tooth down here right behind the bottom canine that often gets tooth resorption. And that's where the body attacks the tooth. And there was nothing you can do to prevent it, but it's really painful. And this is where cats often get them.
Huh.
And you need to get them taken out. So if you see, it'll be like a red kind of strawberry lesion right at the base of the tooth where the gum meets the tooth. And it's important to get those taken out. And if your cat gets one, the chances that they're going to get another one are so high. So that brings us to dentistry with anesthesia, which is a very painful point for people.
It's a sense, when you say painful point, yeah, people have a lot of resistance to this idea of having to clean teeth under anesthesia.
Yes. And we have to do it. Because when we go to the dentist, they take x-rays, they get underneath our gum. We can't do any of that in an awake animal. And so I'm holding up the dog model again. Look how much of your dog or cat's teeth are sitting underneath the gum. And so if we can't take a look at that, we actually can't see what's happening. And so there's so much disease that happens under the gum and so much painful disease that I think it's important for people to understand. Anesthetic-free dentistries are just not enough. They make your animal's teeth look better because they scrape off the tartar we can see. But there's so much disease happening under the gum that we can only see with x-ray or sedated exam.
Well, and I think that's an important point because we don't do dentistry in our practice because we are mobile vets, so we just don't have that equipment or ability to monitor anesthesia out in somebody's house. That would be a risky endeavor. So when I was looking for a veterinarian that I wanted to trust in my area to do the anesthetic dentistry for Bodhi, I was shocked at how many don't do full mouth radiographs as standard procedure.
No way.
Yeah, it's still. Yeah.
I don't like that.
They were only going to do it if they saw something suspicious, which is how we used to do it when I practiced like 20 years ago.
Well, gosh, this has been standard of care for a really long time now, though.
Yeah.
I graduated in 2007, and it was standard of care at the time that full mouth radiographs. You have to have a good reason to not.
Yeah. When I first started, it must have been like 2004, 2005. I think we still didn't in the practice. It was not until we were under anesthesia. If they saw something that they were suspicious about, that we would. And so I was surprised to still have to ask that question. And I would really encourage you as a listener to make sure that that is part of the practice.
Do not take your cat or dog for a dentistry if they're not doing full mouth radiographs, except for if you're just checking up on a root canal or if you're just checking up on, there are some times where I don't think we have to keep taking them over and over again, but there's really no reason to get to that point to sedate your animal and not do them. And
I don't even think the expense is that much more.
No, and it takes 2 seconds. If your nurse is good at radiographic positioning, it's so
done.
Easy. Everything is digital these days. The radiation is insignificant. You will get more radiation from walking downstairs into your basement than taking these digital radiographs. That's mind blowing to me, and I have to say I'm pretty disappointed.
Yeah. But that is the truth in veterinary medicine. I would imagine in non-big cities, that might be the standard of care not to include that.
Yeah.
So just ask that question when you're scheduling.
Absolutely. And ask who's doing the extractions. I've worked in some practices, not recently, where nurses would do full-on surgical extractions. And that is scary. Because you're in some very scary structures nurses do not have a license to do oral surgery. Nurses are definitely the ones that are qualified to be doing all the radiographs, the scaling, the polishing. They do their own exam and the veterinarian comes in and does another one. But when veterinarians are like, I'm going to keep seeing rooms and I'm going to let my nurse do surgical extractions, it's so unfair. To literally everyone in that system. So you want to make sure. I would say most practices would not do that, but just you telling me that a lot of practices
I don't know for now. I have seen that happen for sure. Yeah. But the single root extractions are pretty simple.
Those are totally fine.
That big that big molar, premolar that you're showing, those 3 rooted ones, like
Right.
not
Yeah, 'cause
simple.
what
Need
we have to
sutures.
do.
Yeah.
Oh, yeah, because it's like, I don't know if you can see, like, those 3 roots.
Uh-huh.
It's tough to section. They often break. And then
They
you're
come out
up,
in pieces. That's
they
what
come
it
out
is.
in pieces. And then
Yeah.
you're up here, and there's this big vessel right here.
Yes.
And I know because I've hit it. And it was probably one of the scariest moments of my time in private practice. And so you don't want your nurse to be alone in that moment. So
Please and thank you.
please.
Oh, yes, but not that. Don't let that deter you. Like, don't let this fear.
No.
Like, most dentistries go so well.
Absolutely.
I have found so many dogs and cats were hiding pain that we didn't know about. And their people will come back and say, oh my gosh, they're eating better. And they're putting on some weight, like just things that they're hiding from you because they're so good at hiding that pain.
Absolutely.
Like Bodie's slab fracture, I had no idea.
No.
But that had to hurt. That had to hurt hella bad.
Were all of the roots abscessed or just one?
I think it was just one, but they were like, it was pretty complex.
I had to get a root canal because one of my roots died from having a filling. And that was so painful. And that wasn't even an infection. It hadn't even gotten to the point where it was infected. Like, it was so painful that when I went to get a root canal, like, I think I fell in love with the endodontist because
you just felt so much better.
Like, he numbed me out and then killed the tooth. And I was like, and when I think about him very fondly. And so imagine our dogs are just always walking around like that. And then they get that taken away. Did you notice a difference?
Oh,
afterwards?
he is so much happier. But I've seen this time and time again. And I'll speak from it. We've spoken about it in a previous episode. But I was really resisting because I knew it was going to be expensive.
Yeah.
I mean, he had so much inflammation on his gums. And I try to do it annually. I really do. And so I think that's the other sticky point for people. It is not inexpensive to do this.
No.
And so how does somebody financially prepare? Like, what age do they need to start? And maybe that's not. I asked that question and that's not a concrete answer, I don't think.
Well, I think it's important, though. I think small dogs, I start at 2, minimum. Because we want to keep those teeth in the mouth. And sometimes we strategically take teeth out to keep the rest of the teeth in.
Because it's so crowded in there.
It's so crowded. And like, especially in small dogs, I'll go ahead. There's a 1 rooted molar in the very back on the bottom. Sometimes I'll just pop that out because then it saves those big teeth in front of it that, they're actually using more. And small dogs definitely sooner. Bigger dogs, I would say by 4 or 5. Or unless needed before, I at least like to get that baseline of like, let's take full mouth rads and, x-rays and let's see what's going on in here. Let's get a baseline. Do we necessarily need it every year? Not necessarily in big dogs, but sometimes, just like people, some dogs are like tartar accumulators no matter what you do.
And cats, I mean, there are certain colored cats that are predispositioned to have just kind of complicated oral health.
Totally. Orange cats have more inflammation in their mouth, and certain cats just have more inflammation. My cats are 2. They'll be 3 in November. And this year, I will definitely take them in and get them have a full anesthetic exams. And they had a little bit of gingivitis as babies, and there's a little bit of tartar and gingivitis accumulation. So I'll do it now, and it doesn't mean I have to do it every year. But if I found anything like tooth resorption or anything like that, then I definitely would be doing it every year.
Okay, so let's go to some truths or myths that I hear a lot. I'm sure you hear a lot. Well, isn't oral health just gut health? So if I treat with probiotics, then I am taking care of their oral health.
I mean, it does help. There are some probiotics that do help oral health, but it's not going to be the majority of it. And so it's not that simple for most cats and dogs. There's such a genetic component.
Okay, here's the other one. Kibble is good for getting rid of tartar on the teeth because they need that crunchy. Mostly I hear that with cats more than dogs.
Yeah, so it's actually kibble is more beneficial for dogs than cats. We know with cats, the carbohydrate film that kibble leaves behind actually promotes dental disease. So you're not doing your kitty any favors by feeding them kibble. And that's a whole nother episode, but that's not going to be helpful. But for dogs, we do think there might be more benefit, but like not a lot. Like if you were to think about, 100% being you're brushing and doing everything you can every day, feeding your dog kibble, and this is just a made up statistic by me right now, is like, it's like 5% of it. It's like a little bit. It's like beneficial, but not in any way that makes me feel like if you're like, oh, my dog really likes this home cooked, I don't know that you're taking a lot away from them from an oral health perspective.
You would be much better off brushing than giving kibble to a dog in terms of like overall, if we're talking holistic being, healthier diet, healthier gut, healthier,
Yes.
So brushing instead of kibble, but I'm not shaming the kibble. I know some people have to feed their dog kibble.
Yeah,
So.
totally. And that's fine.
And the other one we hear often is I'm giving my dog, and I just said I did it. I didn't do it for that reason. I just did it for pleasure. But the hard bones or the antlers or what's another? I mean, tracheas are kind of on the softer side, I feel like. But those really hard things in an effort to have the dog take care of the tartar through chewing.
Right. I mean, it does remove some tartar, but then it also removes your dog's tooth enamel.
Yeah.
In a really kind of pathologic way. And so this is like an unpopular take as an integrative veterinarian, but I don't support raw bones. Like it's just not worth it because I don't want my patients to be in pain. And so it's a no for me for all of that stuff.
It's so hard. I will say when we talk about food is love, like they're just so happy when they get those things.
I know. So it's really easy for me to say. I'm like, don't do it.
Oh, well, I'm $1,600 poorer. So I probably won't do it again.
Yeah.
Well, and the truth is, so what's the rule of thumb? This is how I know the rule of thumb. If you can't put your fingernail in it, like if it's not soft enough for your nail to go into it, it's too hard for your dog.
Oh, I like that one. I've heard, and the one I've said is if you can't hit it against your kneecap.
Oh, I would rather put my nail in something than hit myself with something.
If you can't traumatize yourself. I mean, I really like Kongs and Topples, and I know for a German Shepherd, though, like that's rough. It's a rough ask. And so it's like, are you more into the mental health of it or are you more into the oral health? And of course, every time I'm gonna choose the oral health because of the position I'm in. And I'm so convinced that we can do other things. But when our clients do it anyways, I still love and support them because I get it.
I'm still employed. I didn't follow the rules. I actually am not feeling bad about that one. Like, and that is what on day of euthanasia will be the thing that I give all my dogs. Like, enjoy your bone.
Yeah.
Okay. What about bad breath? Is that always an oral health thing or is that sometimes something different?
It's not always oral health. Sometimes it's digestive health. Sometimes it's metabolic health, like a dog or cat with kidney disease. That's advanced stage kidney disease. They might have bad breath for, other reasons, like all the toxins that have built up in their bloodstream. But I would say the majority of the time, it's dental disease.
Yeah.
Until proven otherwise.
Well, and I think about when you mentioned earlier finding the strings or the oral tumors in cats, that's pretty commonplace. I can think when you said it, I just had all of the, just rememberings of all of these times that's happened.
Yeah.
That's pretty commonplace, which is just a good reason on its own to have an oral exam for your kitty.
Yes.
And the last thing we hear about is, do they need a toothpaste? Not the last thing, but the last thing that's like on my mind.
Last things we're going to talk about today. No, you don't have to do a toothpaste. You can. People like it. And sometimes dogs like it too. They make all these like flavored ones. Some people like to make coconut and baking soda paste. I think it's like whatever works, but you don't have to. You can still get tartar, accumulation off sometimes after it's been built up with a toothbrush. But what you're really doing is preventing the tartar bonds from forming. So it's like when you're taking your toothbrush to the teeth, what you're doing is disrupting the tartar bonds that form within 48 hours. So even if you don't brush every day, if you brushed every other day, that's how long that calculus takes to bond and kind of build up.
Which can really help with the gum inflammation too.
Absolutely.
And then that perio care, I've seen a real difference in my dogs in terms of like the inflammation that they experience. Like it's effective. Like you can see it.
Yeah, I like this stuff because it is easy to put on and my cats don't mind the taste of it. And I feel good about using it. And it does help. Both of my cats have inflammation over their canines, upper canines, and it helps when I do it.
Yeah. Okay, well, I'm going to do 2 plugs to roll us out of here. Okay. One is I was helping someone sign up for insurance yesterday, and it was dental was not included in it. You had to look for like underneath, to find, oh, I want to also have dental health included. So I would encourage people, it didn't bump her premium that much at all.
Oh, I didn't even know you could have that included. I've never even seen that included in an insurance as an option.
But I would be so curious. Well, we had one insurance payer that denied a dental cleaning for a dog because of a pre-existing condition in which you had named tartar and gingivitis in the exam notes. And I thought that was where one of my pain points with insurance came. So it's just like, come on, everybody has tartar and gingivitis. To call that a pre-existing condition to not have dental cleanings felt shady, to say the least. Yeah. So when you're looking at your insurance plan, I think it would be important if you're going to purchase, I think it increased your premium like $4 a month.
Worth it.
Yeah. So do that. The other plug is, if you're watching, like, did you see the toothbrush that Dr. Angie was holding up, which is so much cuter out of the box because the color was so vibrant. But we do carry at Natural Cat Vet. That's the other site. We should put these on Boulder Holistic. We should. As well. But they're just designed so well for cats, made by cat people for cats. But I would say use this on your dog, your small dog mouth too.
Absolutely. What I really love about this.
I'm going to just flash colors while you talk.
Okay. I know. They're so fun. Yeah. This is the stuff when JoJo and I are having a bad day, we look at colors and stuff. Okay. So look how nice this is. Like, okay, see if I can make my camera. Okay. It's so fine that it's kind of like flossing. So let me see. I think I'm holding this upside down. But you can see how then it helps you get in between teeth, especially up here. And these are designed for cats, but I would use them for small dogs in a heartbeat, or even big dogs if you just want to get in between more. And then they have 2 different. So they have this head and they have this head. And I love them. And they are definitely catching on. I see them more. And this toothbrush, this toothbrush was designed for an orange cat. So that's the story behind this toothbrush. And I love them.
I think they got like product of the year or something. And I understand why. Because this actually makes me want to pull it out. Like I want one in each color for my dogs. And I think it's way more about me. And I'm just not going to tell them that it says cat in like giant letters across it. So, don't tell them. But anyhow, that was a shameless plug for something I love that we carry.
Yes, I love it too. Well, we would love to hear from you.
So much more. So let's exit. Sorry, I cut you off in the exit.
Okay. We would love to hear from you. Whatever platform you're listening to us on, leave a comment. Leave a review. It helps us so much. Even if you tell us that you hate us, it still helps get the word out. And we love you, even if you hate us.
So true. No matter what, if you're brushing or not brushing or feeding hard bones or not.
Right? Yeah, it's okay.
Yeah,
it's okay.
Totally okay.
Okay. We'll see you soon. Bye.
Bye.